On Monday, nurses and healthcare workers at 15 Sutter Health facilities across Northern California went on a one-day strike. One of those facilities was Sutter Coast Hospital in Crescent City. During the Monday edition of KFUG's Community Service Program, we spoke with Tiffany Dotson, an emergency room nurse who was out on the strike line at Sutter Coast Hospital.
Sutter Coast Hospital RNs and 15 total Sutter hospitals in Northern California are all striking and gave 10-day notice to do a 24-hour strike today. So we're currently standing out here in front of Sutter Coast Hospital in Crescent City with our signs in the rain. We joined the CNA, the California Nurses Association, last year. We have been negotiating a contract, our first contract here at Sutter Coast, since June of last year, and we've seen no progression, no agreements. If any, and little bit of time at all from administration at the table to even negotiate a contract at all. We're out here trying to put some pressure on them and say, hey, look, we need a contract. We need to provide some safe staffing and some standards to the care that we're providing our community and our patients. And because of this, and because we chose to strike and stand out here, we've been locked out for 5 days after today. So none of us can return to work until Sunday.
You all have been trying to negotiate with Sutter since last year, right?
Yes, June of last year. We've been going through a pandemic for, we're going on a couple years now, and, we've been working with less and less staff and more and more travelers. We're seeing less support, less resources and availability, and at the same time trying to negotiate a contract that provides that safe care for our community and staff during these times. And, making sure that we can continue to provide that care after. They've reportedly only have met with us at the table for up to, 15 minutes at a time versus sitting at a table negotiating for an entire day that's set aside. So we're not getting very far in agreements, and what agreements they have offered us have been less than what we already have currently at Sutter Coast Hospital.
Can you remind the people in our community what it was like for y'all to be working in the hospital during the worst of the pandemic here in Crescent City?
Well, for Crescent City in itself, we're in a rural community providing rural nursing care, which is much different than many hospitals who are staffed with, expertise and, much more availability and resources. Here in this area, we are it. You don't have specialists. You don't have cardiothoracic surgeons or, respiratory specialists. We're it. We're all you have. And, we were working extensive hours, some of us up to 18, 20-hour shifts, trying to provide care to the community. And much of this community was our family and friends. So it was a little more impactful to us. And, how that, it's just really hard to even talk about.
Sure. I can imagine. I mean, many of us in the community talked about what was happening at the hospital, and we had our own thoughts and feelings about it, but none of us were actually in there having to deal with it,
right,
like you and other healthcare workers were.
Yeah, there was times that we were running from room to room, and, the goal in nursing is to be able to provide, the standard of care that is consistent across the board and for everyone. And we never want to feel like we have to run from one room to the next room and not provide that last patient the care that they deserve or need. And, that's why we're out here today, because it's gotten to the point that there's some unsafe circumstances that have occurred and put us in positions that weren't safe for ourselves and weren't safe for patients. These shortages of retention and nurses leaving the community because they don't feel like they're safe. I myself was assaulted by a patient 3 years ago, and I actually just got my workers' comp case picked up within the last couple of months. My arm was broke, and I didn't have the support from our facility to provide this, the health care that I needed for myself to continue to work, and was off work for a year without pay.
During the worst of the COVID-19 pandemic, we were all encouraged to think of our frontline healthcare workers as heroes.
I had a hard time with that, going through a lot of emotions. When we were working during these times, I heard that several times, we're heroes, et cetera, and I just thought, a normal human being going to work and trying to do my job. I don't want to be treated any different. I just want to make sure that I have the support, I have the resources that I need to continue to do my job. You know, it's something we chose to do as a profession, and so I come every day to do that job. We're human, and we need to be treated like humans.
Sutter is bringing in so-called replacement workers. Other people would call those people scabs. And my understanding is that they're like overstaffing with the so-called replacement workers. And at least as I understand it, that means that they're basically giving these people the support that y'all have been asking for, but they wouldn't give to you. Is that basically it?
You know, today has definitely shown what Sutter Coast Hospital and Sutter Health across the board is capable of. We had 2 RN positions cut at the beginning of a pandemic, a time when you need your staff, you need those extra resources. We had 2 RN positions cut. They began staffing us with an LVN in the emergency department to increase the load on the RNs. On top of that, you know, they were cutting us and flexing our hours, and today they've hired extra staff to cover us as they blocked us out. They've given us a guilt trip that, you know, they would hope that we would return to work. We would not strike today. You know, they would hope that we would be there for our patients. But I sent our CEO an email that reminded them we want to be here for our patients. It was Sutter who kept us from our patients for the rest of the week. They're the ones that chose to lock us out and keep us from our patients. And I think that needs to be clear. They did bring in strike travelers, to cover our shifts with little training, no training. We're getting word from inside the hospital that, you know, many of them don't even know how to use a computer system, and so that kind of causes some concerns.
When you say CEO, do you mean local CEO Mitch Hanna, or do you mean someone else?
Yes, I've replied to several of Mitch Hanna's emails personally to let him know that, you know, I am reading the emails, and, you know, and here's my response to the email.
So what does this mean, being locked out? I mean, what's the impact? I mean, I think I understand, but just
for
yeah, go ahead.
The nurses, we chose to strike for 1 day. We lost a day of pay for all of us that were scheduled to work. We gave up that pay. But now that we're locked out, we cannot return to work until Sunday. So, you know, we work 3 days a week. That's half your paycheck we have now had to give up and been locked out of. So it's basically putting a lot of nurses on the fence, because can they really afford to support their families?
Right.
They were told today that they had to show up and sign a paper stating that they would not participate in a strike in order to get paid for the rest of the week and come to work.
I actually had a discussion with somebody last night about this issue of, oh, well, there are patients, and what about the patients? And the patients need care. And my position is, well, yeah, but Sutter put y'all in this position and is now trying to guilt trip you about, you know, the fact that, oh, how dare you actually try to, like, work and get safer conditions for yourself.
You know, in nursing, we would call that behavior gaslighting, you know.
Well, yeah, we would call that gaslighting out in the real world, too. Not to say that you're not in the real world, but go ahead, I'm sorry.
No, that's fine. I mean, and that's a good point to make. You know, is there really a nursing shortage? There is no nursing shortage. These nursing shortages are all created by, you know, hospital corporations and profit margins and attempting to enhance their profits. The emergency room in itself is not a profit-making business. We're here to support our community members and provide care, and their care should not be dependent on, you know, how much money and, you know, how many staff members they have according to how many patients they have at that particular time. You know, the fact that they can bring in security officers from out of town and, you know, staff our parking lot with Security Protect Administration today just shows where their money is sitting.
They brought in private security to protect administration?
I'm staring at currently 6 private security officers standing in our parking lot in front of the hospital right now. And
there's, who are they protecting administration from?
Well, those inside the hospital. I guess if they feel like maybe we're going to be violent, I don't know, but we're just here to protect, you know, make a statement,
sure.
Stand up, and let the community know what's really going on inside the closed doors.
What happens next?
We're going to continue to go to the negotiating table and You know, there's 8,500 nurses on strike today between 15 Sutter hospitals, and hopefully Sutter listens to us in the community today and comes to the table with some fair negotiations.
For KFUG Community News, I'm Mike Thornton.